Hi, welcome back to the Chinese Medicine Podcast. My name is Marie Hopkinson. I'm a Chinese medicine practitioner, and today we're going to be delving into our series for students, people studying Chinese medicine. The functions of the heart. Now, okay, so the next one I want to talk about really quickly is opens into the tongue. Now, what does this mean? So the tongue is considered like the rudder of the heart, I think they say, or the offshoot of the heart. And he gets this from the spiritual axis in chapter 17. It says, heart chi communicates with the tongue. If the heart is normal, the tongue can distinguish the 5 tastes. So things where like you might associate heart, and this is also where it's not just the tongue, it's the consciousness, right? So if someone gets stuttered or slurred speech, then in a TCM sense, that would be linked to fire and the heart. One is through the shen, you could just think of it through the shen, and secondly through the tongue. And the other thing that TCM people love is looking at the tongue, right? So the tongue diagnosis. So when you do tongue diagnosis, they'll give you like a map of your body on the tongue, and all these different areas relate to different places. But in a general sense, the tongue as a whole, the whole tongue, relates to the heart. So if the tongue is in general pale, in TCM, that's a blood deficiency. But because it's the tongue, we could say, well, the whole tongue's pale. Maybe there's some heart blood deficiency. Maybe is there something to do with the heart? If the whole tongue is red, particularly the aspect of the tongue, the heart within the heart, is the tip of the tongue, the very tip. So that aspect relates to the shape of that tip. And when you do tongue diagnosis, I'm sure your teacher will go through all the different ways and things that it could be. But that very tip, if it's super duper red, red means heat in Chinese medicine, fire. And so that could be that restlessness and that anxiousness and that sort of or a shen disturbance kind of issue, that kind of stuff. So the thing is what I said before about joy and excessive laughing, and that could be seen as a way of excessive joy. It could be seen as a relationship to the heart through the tongue as well. And also when a person talks incessantly, like when they get manic, like if you've ever seen a person with a severe mental disturbance who hasn't been treated well, or treated properly, let's say, even I would see this with a lot of homeless people, they're just kind of muttering on the street, muttering to themselves, like indistinguishable speech. That's one, is it's a shen issue, but it relates to the heart through the shen and through the speech and through the tongue. But particularly people who have trouble speaking, or they suddenly have a difficulty speaking. Now this could be post-stroke, and one way Chinese medicine could see that is, okay, through the heart. So it's just a different way of looking at things. Yeah, okay, you've had an issue with your brain because you've had a blood clot in your brain, and that's caused a damage to an area of your brain. Now your speech is affected. So even in that sense, you could think, okay, well, the brain, that's affected the consciousness, which has affected the brightness of your shen, so that relates to the heart, but it's also then affected your speech, and that relates to, either way, it relates to the heart. So Chinese medicine is nice when it all kind of lines up like that. It's lots of different roads to the same thing. Control sweat is another thing. So there's a thing with body fluids and blood that's like a commonality, and there's a few different ways to kind of look at this. One would be, okay, because they're both fluid, they're yin, and one would be to think, well, because they're both warm fluids, when they're in the body, they're yang. Well, there's yang within yin. So when you, like, sweating is like what's in Chinese medicine called a lesser form of bleeding, right? So most people know it's not a good idea to bleed a lot, right? So if you cut yourself and you're bleeding and bleeding and bleeding, you can't stop that bleeding. You could die from losing too much blood, or you have an accident, you're bleeding internally, something like that, or bleeding, you're physically bleeding all your blood out. But you can also die from sweating too much. And we don't really see that a lot these days, but in the I guess the pre-antibiotic times, where people would get really high fevers and they wouldn't be able to stop those fevers, they get very, very sick. Or when we didn't have good hygienic practices, people would get much more easily get dysentery or get sick from food, like food poisoning type of illnesses where you get contamination from like not washing your hands after using the toilet. In countries where you get dysentery, they say the 4 main things is food, flies, feces, and fingers. That's it. Food, flies, feces, and fingers. Because those are the 4 main contaminants, the way that those pathogens kind of contaminate you from those different places to other places, right? So in Australia, where I'm from, and in other countries that are westernised countries and cleaner countries, or places where there's good sanitation and hygiene, even some eastern countries are pretty sanitised and hygienic, or they just have proper waterways and they have proper toilets and sewages. You don't realise like how much that helps us help us have good health. Like, it stops the spread of disease. It helps us be healthier, and we just don't. It's just not a thing we have to worry about. But yeah, in the older days, older times, people did have to worry about that, or that was a thing they'd have to contend with. Not having access to medicine, like not having access to a doctor. Like if you've got a fever, and your doctor's like, got to ride on a horse, 2 days away. By the time they got there, the patients often would very close to death or died. Even just saline, infusions of saline, like saline, IV drips, is life-saving medicine, right? So there's lots of things where we don't really sweat to death anymore from those things, but it's a possibility. And certainly back in the Han Dynasty, when some of these original concepts were being written about, when the Neijing and stuff, like, they didn't have all these kinds of access to all these medicines, and transportation and things like that were big problems for people. Like, as in, you just didn't have a doctor on every street corner ready to help you if you lived in the countryside and you were sick. You might have to just, different times. Anyway, it's not meant to be a rant about the wonders of modern technology and living in 2020, but I think it's something to just be grateful for. Like, we should be grateful for that stuff. So anyway, what I'm getting at is sweat and blood are similar in that way. So they're similar in 2 ways. They're similar because they're both yin, they're fluids. They're similar because they're both yang, and they contain yang. They're yang within yin. So when you sweat, you can lose yang. When you sweat, you can lose yin. And particularly losing yang is a big deal because that is your vital substance of life. So that is your function. And the more and more you sweat, and this is why in a text like Shang Han Lun, which is like the oldest clinical manual that we have of herbal medicine, which kind of has a step-by-step process how to address a patient who started off getting sick, and then they could end up just dying from sweating, basically, and lots of different permutations of how they could get sick and what could happen if mistreatment happens and all that sort of stuff. So, and there was also like a lot of precautions in that way, because people often tried to sweat by a different method. So if you didn't have access to herbs, like if you get sick with a cold or a flu, your pores shut, and you often can't sweat. So that's one type, and another type is the person's deficient person who gets sick, and then they just sweat already. They're sweating profusely. So if you've ever had a cold or a flu, particularly like an influenza kind of thing, where you just get very shivery and cold, you think, I can't get warm, and you put all these blankets on or whatever, and you still can't get warm, but you're not sweating. Your pores are so closed, you need herbs or a treatment that's going to open the pores. Now, what they used to do in the Han Dynasty as well, because herbs are more expensive and less accessible, I guess, to everyone than acupuncture, and people used to do a thing called fire needling. Now, we still do fire needling today. There's nothing wrong with fire needling, but it was just how they were probably, the way it's written about, you think they're just all running around with fire needles trying to stab everybody with them. I know they weren't doing that, but the fire needling is like heating up an acupuncture needle and then sticking it in. Now, what can happen when you do that is it shocks you, and with that shock of your body, that can damage your shen. So the patient might not be expecting it, or they might be the way it starts up the sweating. So if you drink a formula that's meant to help you sweat and it's properly prescribed, you're not just going to drink it and go boom, break out in a sweat. You're going to drink it and like gradually a sweat's going to come out, and and then you also, the herbalist would give you something to make sure that you don't keep sweating, like to stop the sweating. So modern day issues that people face, and you might see this with your patients, is people that do a lot of exercise, they sweat themselves into dryness, or people that live in a sauna and they sweat themselves into dryness. Now there's nothing wrong with going in a sauna, but if you don't stop the sweating afterwards, then you can keep on sweating and sweating, and then that's detrimental to you. So I don't want to do too much of a long rant on sweating, but that is just something to think about. And so people that sweat very easily would be something you would consider to be associated with the heart, and more to do with a lack of yang to be able to kind of close the pores. And that is also to do with the lung. So when we go to the lung, we think of the lung opening and closing the pores, like opening and closing the gate. And so once that gate's open and the sweat comes out, the more you sweat, that damages the heart yang, or damages the heart. But the fact that the doors got open might be relating to the lungs or other things. So go through that later on. But anyway, that's just something to think about if a person has a lot of sweating. A Chinese medicine practitioner wants to think about that in terms of bleeding. So whether that sweating is self-induced from exercise, or whether that sweating is a person that can't stop sweating from an illness. So they might say, I got sick a few days ago or a week ago, and I'm just sweating and sweating and I can't stop sweating. And there are certain kinds of high fevers where people get very high fever, and they get very high, that's how they die from sweating. That would be like a Yang Ming situation where they just have a really high fever and they get very thirsty and they can't stop sweating. You don't see that often these days. One is because of modern interventions. A lot of people go and do something about it before that time, but also you have to be a very strong person. It's constitutionally, not a very weak person can get that kind of sick. All right, let's stick on the topic. So the heart, the last one is, so in Giovanni he talks about a deficiency of heart qi may cause spontaneous sweating, while a deficiency of heart yin may cause night sweating, and the treatment should be aimed at tonifying the heart yang in the former case and heart yin in the latter. So I'm just going to mention this, like the kind of sweating for the heart. Spontaneous sweating, what that means is the person hasn't done any exertion or anything, they just suddenly break out into a sweat spontaneously. Woo. They usually, people with deficient heart qi can often be easily frightened people, easily scared people. So you don't have to do much of that, all like that, like come up behind them and they kind of do that. Or people that frailer kind of people in that, they easily scare, and they might be just less connected in their consciousness to themselves. So they easily zone out into like woo land or something like, oh sorry, I wasn't, and that's how they can get that easy scare as well. Like they're not present in the moment that easily. Okay, so that's one thing. And there's lots of different ways of looking at it. In a classical Chinese medicine sense, we don't really think about the yin deficiency sweating like in this same way, but I just want to kind of cover this a little bit for people that are doing the stock standard basic TCM. But just to let you know, there are different ways of kind of looking at that. So we would just think it's like deficient yang floating to the exterior, and making the pores get open, and then that's why the person's sweating, right? They don't necessarily have to be yin deficient to have floating yang and to sweat. But when you sweat, you're going to lose yang. That's one thing to think of. And when you sweat, you're going to lose yin. Now, a lot of textbooks just say you're going to lose yin because it's a fluid, but you need to think of it as it contains yang within that sweat. It's alive. It's a warm fluid. There's a little bit of yang within it. So that's important to think of. So that's why in the Neijing it kind of says in the precautions of what you should do in different seasons, like especially exercise-wise, it basically says, exercise in summer. Like in summer, your yang is on the surface, so it's okay to sweat, but in winter you should be preserving it and not sweating. So a person that goes and does very strenuous exercise in winter is kind of very much going against nature and what naturally should be happening in that time. So the next bit he's got in here, he's mentioned dreams, which we've already mentioned, and controlling speech, and that's through the tongue and through also the consciousness. So you need consciousness, Shen, to speak and to be articulate. So people that can speak very well and they can articulate their words and they can talk eloquently or clearly would be good Shen. If you're very tired, like you might notice this. I mean, when I make these videos, if I'm very tired, I'll kind of be like, oh, blah, 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 stumbling over words or not be as articulate in how you're talking. And that's just natural. Okay, so when you're tired, your body's saying, go and have a rest. And so the tiredness could happen because you haven't had good sleep the night before, and that would affect your Shen. That would affect your consciousness. And that's why, when we're tired physically, you feel exhausted mentally. Like you feel, I don't feel like doing this, I don't want to do this. And you may have a lack of passion or desire or joy about doing it. But then you can have other days where you think, wow, I just feel so energized, I feel so good, and I feel so happy. And that's why, because that connection between, often, not always, but often, is through blood and that replenishing of blood. So the most important things to remember about the heart, it would be the connection between the heart talking to us as practitioners through the pulse. That's important. Sweating is important to remember, that sweating and that relationship between blood and sweat. And we often think if a patient came to you who was bleeding, you would put something on it and stop the bleeding. So if they're sweating, it's a lesser form of bleeding. As a practitioner, we kind of are a bit more alarmed about it like that than just like other practitioners. So that's one reason why acupuncturists, herbalists, and like TCM in general, like Chinese medicine, they're not big advocates on sweated out detox kind of things, because that's detrimental to your body. Now there is a popular thing going around now, which is like the ice baths and stuff like that, and in a way that kind of freezes the surface of the body and pushes the yang inside, and it's kind of the opposite of living in a sweaty environment. Like when you're in a sweaty place, like right now in Queensland, it's a sweaty environment, it's a hot environment. So when you go into the aircon, it just freezes the outside of your body, and by freezing you, that pushes the yang to the inside of you. It's just really interesting to kind of think that. And so when you're in a hot environment and you're sweating, it's normal to feel tired, because you're all lethargic or lazy or slow down. And there's other videos that I've done on the importance of, or how Chinese medicine looks at nature teaching us different things, and how we have different lifestyle things, different things in nature, different seasons. So yeah, I mean, I love the aircon. I don't want to live in a hot, sweaty environment, but at the same time, nature's giving us that hot, sweaty environment. Like, we need to interact with it accordingly and not hate the environment, not hate nature. So just something to think about for people, and to ponder. And that's how you learn Chinese medicine. So thank you so much for watching this. I hope it's been helpful to you. If you're a student of Chinese medicine and you find this series helpful, please leave a comment below. If you haven't subscribed to the channel, make sure you subscribe. What are you doing? At least subscribe to the channel. And give us a like or something like that down there. That really helps us grow. And so thank you so much for watching, and I look forward to seeing you again on the next video. So wood, fire, earth, we'll do earth next. Probably we'll do earth next, which is the spleen. We'll talk about spleen and digestion and transforming and transforming and transporting and all the stuff to do with earth. So thank you very much, and we'll see you again on the next video.